Amanda Rigby. I've known you since before you had a couple extra letters after your name. You've been a friend of mine. You've been a colleague of mine. You've even been a mentor of mine. I've learned a lot. We've spent some time at conferences, on the road, shared a lot of meals together, and I have to say it's been really fun. And you know, my dad is a medical doctor, so I understand what that training looks like. A lot of people do. What does it take to be a registered dietitian? What is that like?
Yeah, so it was surprising to me too, even maybe 4 years into the program, what the next couple of years entailed. I thought we just signed up for dietitian school and then graduated and became a dietitian, but that wasn't really the case. So we get accepted into the nutrition and dietetics program in undergrad, and then once we graduate, we then enter into this pool for what would be our dietitian residency, kind of like a medical residency. And I guess there's like a 30% acceptance rate, so I was one of the handful of people in our graduating class that then got shipped to another state where we did our 1 year of supervised practice, and then we sit for the boards, become the RD, hold down that credential, and start practicing.
So you also, I remember we've talked about some stories about how in especially a hospital setting, it's, you roll your eyes already.
Did I?
That it's not exactly, like, tell me, what's the eye roll about? Like, why isn't it what you thought it was gonna be?
It was frustrating and almost disheartening as soon as it started. I remember being so excited and, I mean, maybe naive and thinking that I was going to like change the world by teaching people about nutrition and how our bodies work and how food interacts with things and, you know, puts us either towards or away from developing a disease. And so I'm like hitting the ground running, kick open the hospital doors, like, here I am, let's help people. And I mean, it's sick care. Like, we were just keeping people kind of where they were, and no one was really getting better, and I also didn't feel like I was doing anything impactful in my position in the hospital setting. We basically would see people. We were the last person they wanted to see when they came in for, you know, a procedure or just came out of surgery. We would then go to their room and they'd kick you right out. So it's a different setting, you know. I feel like nutrition is preventative more of a, you know, a take on medicine. So in that setting, you know, an acute critical condition, our role is more so, again, almost to maintain them. So we feed them intravenously, and that's about it. So the communication isn't really there, and there's definitely not a follow-up setting at all. So it doesn't feel as impactful as I maybe thought it was going to.
It's interesting that you call it nutrition, because, you know, when I think about that, what you're talking about, when I think about balancing a meal, I think about a meal. I think about lunch. I think about what I'm going to make my family for dinner. I think about what I'm going to serve on a holiday or a birthday party. And you're from New England too, and so we have these big families and big traditional meals. And you love food just as much as I do.
I think that's why I started. I was like, I love food. We can study it. This is cool.
But how did food just become nutrition in this?
Yeah.
How did it become numbers in the registered dietitian world?
Yeah, I think that's pretty much what it did become. You know, it's protocol, it's treatment plans, it's specific handouts per X disease state. So it was very structured and regimented, as I'm sure it should be, but it really lacked the individualized piece of it, that there's another human sitting in front of you that has a story, that lives in a household with other people, that has stressors, that doesn't sleep well, and we expect that this one size is gonna fit all. And I really think we did a disservice to these patients just thinking that these blanket statements were gonna cover them, you know, not taking anything else into consideration.
Which is not the principle that you have your practice on now. So what changed? What was that turning point, or who influenced you?
Yeah. So right before I was about to leave for my residency, so I'm, again, so excited. I got this position, I guess, this placement that no one else had gotten. So we were almost guilty for feeling as excited as we were by the downfall of all of our other peers, right? Like we were this 2 places and we were one of them. So I'm so excited to go. I end up just by divine intervention at this, meeting this woman. And I remember just feeling so confused and like as if I was supposed to be the authority on food and disease states. And I had no idea how she would have even have done that. And I'm like, why wasn't this what I was learning for the past 5 years? You know, what did I spend all this money for? The textbooks and all of this knowledge that I do have, why couldn't I have applied it like she did on her own? And that was how I was introduced to what is called functional medicine. And I mean, from there was no turning back. We're now seeing, you know, functional medicine is taking that person's story and seeing the body as this interconnected system, that one thing plays off of another. We're not just putting Band-Aids on what hurts over here. You know, everything's connected. And once I was able to then use the prior schooling to push everything together, that was it for me. So I knew the only place I could then put that into practice was my own practice. So that was the first thing that I did as soon as I passed the board exam. I signed my life away and opened my practice, because that's the scenario where we can start to have the time, the space, the resources to see the entire person and start to treat them.
Where did you learn about functional medicine?
Yeah, so I enrolled in a school program online while I was doing my residency. So I'd get home at 10 o'clock at night, I'd log on, I'd do my courses, I would listen to my podcasts or my classes on my commute to the hospital every morning. So I was kind of dual learning, I guess. And yeah, so I stay enrolled in one of the programs, because another disservice I think we do in healthcare is that we stop learning. And especially nutrition is an ever-changing, evolving science now that we know, you know, nutrigenomics, that we now can influence our genes with nutrition. And there's so much to it that we have to keep up with the science as it comes. So I stay in one of the functional medicine schools now to stay up to date with everything.
How would your patients describe what you do with them today? Is it just, you know, formulations and calculations and meal plans, or, you know, when you say that you look at the person, what does that mean? How would they describe you?
We have so much fun. For me, the initial thing is giving back the power to the patient and having them also recognize this relationship is going to be a two-way street. There is not, again, this one answer from one doctor or one protocol that they're going to have to follow that we've been doing for so long. They've been going to their doctor looking for the answer, and we're trying to empower them to change this dialogue that they've been stuck with of, I'm stuck like this forever, this is what my life looks like, to I can heal and healing is possible, like, and it's in my control. So that's the initial conversation that we'll have. And it's building this relationship of this back and forth. I'll do the detective work for you and connect the dots, but I also want to show you how I did that so that going forward they can identify triggers or things that might stress them out, food sensitivities that maybe they've been eating forever that have just created this low-grade chronic inflammation their whole life that they never noticed before. Just empowering them to kind of get in the driver's seat of their health outcomes and know that that's their duty, you know.
I wish everyone that I paid money to did that. Like, I'm thinking about the guy that comes to fix my dishwasher and doesn't show me how to fix it next time it's broken. That's what it sounds like you're doing.
I mean, I say it all the time. I'm like, I want to love on you and then move you out of the way. There's so many people that we have to help in the positions that we're in as practitioners, that we have to give them all the tools, you know, empower them, hold their hand along the way, build it together and on their journey, and then let them go and take what they've learned and help other people, because there's a whole world we got to help. So yeah, I want to teach them, like, I don't want to hold any secrets back, you know, like, teach them what we know in the most duplicatable, actionable way. So in practice, we will get that established. But then I like to incorporate a lot of, again, with the ever-changing science and technology, now we pull in genetic testing, we pull in micronutrient testing. I have an additional certification that only dietitians can get in what we call mediator releases. So that's how foods react to the immune system, and does it create an inflammatory response? What if it does? What do we do from there? And this is how we create that like individualized wellness that we're missing in healthcare. And that's where I think we're going in the future, because as more and more people are getting better and practitioners are seeing these outcomes that we've never had before with our outdated protocols, again, looking at this whole person and meeting them where they're at and then building something for them is what works. Like, that's healthcare.
Let's end on this, because you are very highly researched and you do, like to peel back the curtain and ask the real tough questions. And I think part of it, and I can relate to this because I think also in my youth and being naive sometimes, and it's almost like my daughter asked me at 6 years old, well, why, Mom, why? And I love that you are like me and that you continue to ask why. But a lot of those questions, are you getting those answered at certain events? Are there any events that you like to get your education from?
Yeah, I would credit most of my experience to that outside learning environment. And I say this every time I leave an event, like things from the NEI, the NutraMetrix Education Institute, or any of the trainings on specific nutraceuticals and custom formulation, supplementation. I was never taught that in the structured school setting, and I leave them and I go, oh my gosh, this was 3 years worth of schooling in that one day. I get so much more out of that because it's applicable, because it's relevant, because it's the cutting edge. That's where I'm learning everything that I'll actually apply from these trainings and outside education more than I would in a classroom, for sure.
I hope that you, in a hopeless time, because a lot of people do feel hopeless when it comes to their gut health, when it comes to their immunity, it comes to their stress. I really do see you as a beacon of hope, as someone who's young and inspirational. And what would you say to a new registered dietitian?
I would tell a new dietitian to keep their eyes open, keep their heads up, and again, just take into account there's a person sitting in front of you and hear their story. That's going to give you all the answers that you need.
A common theme that we're hearing from a lot of these NutraMetrix stories. So Amanda Rigby, registered dietitian, I know that is a badge of honor. You worked really hard to get to this plate. So congratulations.
Thanks.
And thanks for doing what you're doing.
Thank you.